Today I'm going to discuss with you an important topic that every dentist should be aware and understand. So that, simply, just to recap, what's the difference between subjective and objective findings? Subjective, it is something the patient should tell you about. It is something depends on the patient's perception, patient's beliefs. Whereas objective, it is something you measure, something you test, something you feel. It depends on the examiner. Let's take a few examples. Objectives, it's like blood pressure, something you test, you measure. Body temperature. While subjective, it is, as we said, something depends on the patient's perception, or something the patient should tell you about. It is like pain. You can't measure pain. So that X-ray, radiographic interpretation, X-ray images, is it considered a subjective or objective? Logically, absolutely it is objective, because it is an X-ray image. It is something within your hands. It is something you see. لكن للأسف الشديد it is considered a subjective. Radiographic interpretations, it is something subjective. Why is that? To understand why is that, let's take a few clinical scenarios. Look to that image. This patient was referred to Maxillofacial clinic to retrieve that root. What surgeon did, he did a lateral window approach to retrieve that root. لكن unfortunately, he did not find a root. Why? Because we misinterpret that image. This is what we see in the image. It is the root. It is not in the sinus. It is overlapped. Why? Because there is, if you look closely, there is a radiolucent line around the root which represents periodontal ligament space. So that misinterpretation of that image leads to a lot of clinical procedures that should not be done for that patient. Another clinical scenario. Look to that image. كثير واضحة. ما بدها اثنين يحكوا فيها. There is a root tip inside the sinus. This patient also was referred to Maxillofacial clinic to did lateral window approach to retrieve that root. لكن if we look closely, there is no pulp space in that fragment, and the bone trabeculations in that fragment, it is the same as adjacent bone, so that it is bone hyperostosis within the sinus wall. It is not a root fragment. We misinterpret that image. Let's take another example. Look to that panoramic image. كثير واضحة. ما بدها اثنين يحكوا فيها. Let's suppose that patient has previous trauma and you order OPG to see if there is any bone fractures. واضح جدا, there is a fracture line across the ramus. We misinterpret that image. This is not a fracture line. This is an airway shadow. This is the soft palate. Appears radiolucent line across the ramus. Very frequently misinterpreted as a fracture line, so that we misinterpret that image. How the patient may be referred for maxillofacial surgeons to fix that fracture. وإحنا ما عندنا fracture. We misinterpret. Look to that image. Occlusal, mandibular occlusal projection. واضح جدا midline symphysial fracture. This is not a fracture. This is the suture, because the suture in that area, it is not closed yet. Look to that image, upper lateral, with, let's suppose with the class 3 restoration, there is a radiolucency around the root tip, which indicates symptomatic apical periodontitis or asymptomatic apical periodontitis, and this patient may underwent a root canal treatment. 2 to 3 days, 3 to 4 days, 5 to 7 days, 10 to 12 days, 14 to 16 days, 17 to 18 days, 19 to 20 days, 21 to 22 days, 23 to 24 days, 25 to 26 days, 27 to 28 days, 29 to 30 days, 30 to 45 days, 31 to 34 days, 35 to 36 days, 37 to 38 days, 38 to 39 days, 40 to 41 days, 41 to 42 days, 43 to 44 days, 44 to 45 days, 46 to 47 days, 47 to 48 days, 49 to 50 days, 50 to 55 days, 56 to 57 days, 56 to 58 days, 59 to 60 days, 60 to 65 days, 66 to 67 days, 66 to 68 days, 67 to 68 days, 67 to 68 days, 68 to 69 days, 69 to 70 days, 70 to 72 da and this is a normal variant. This is a lateral fossa, very frequently misinterpreted as apical radiolucency. Look to that, another example. Look to that image. Deep restoration. Beneath that restoration is the radiolucency, which may suggest a recurrent caries. And this patient may underwent root canal treatment or replacement of that restoration because there is a caries beneath restoration. We misinterpret that image. This is not a caries. This is base or liner, because some bases and liners materials appear radiolucent. So that, look to that coronal section of the CT scan. Obviously there is a zygomatic arch fracture. This is very frequently misinterpreted as a fracture, non-displaced fracture. لكن للأسف الشديد there is no fracture at all. This is zygomaticotemporal suture, which is very frequently misinterpreted as a fracture line. We did a lot of mistakes, a lot of misinterpretation of radiographic images. So that radiographic interpretation, it depends on the examiner. It depends on your knowledge. That's why radiographic interpretation, it is something subjective, not objective. لأنه نفس الصورة ممكن اثنين يشوفوها، واحد بيحكي لك this is normal، واحد يحكي لك this is abnormal. So that if you need more information regarding radiographic interpretation, I really recommend you to have this book. There is a lot of data regarding radiographic interpretation and misinterpretations. I hope you enjoy it, and if you have any questions, just write it down and I will be pleased to answer them. Thank you for watching.